Hey, I'm back. I just wanted to make another quick video talking about healthcare after surgery. So it's kind of like a side comment about the challenges that people who go to Mexico are going to face coming back to the U.S. and suddenly having to notate on any like emergency room notes or surgery notes that you've had, specific surgeries and what surgeries you've had and what the they're going to ask questions like where you got those things done. So I know that on the groups they talk a lot about this, and so it's something that I think everyone who's going to go into getting surgery needs to be aware of, is that before surgery, before I made the plan to actually go to Mexico and get this done, and I had talked to, going back a whole bunch of videos and talking about the person who really was the catalyst for me. She works for my insurance company, and so going back to that, I had talked to her and asked her, are the things that I've got, done covered if I come back and I have complications, which I've had 0 complications, so it's, not yet a concern. I mean, I could always I could have complications going forward. I had heard of one person at least getting, like a lot of scar tissue built up inside, but I think it's important to note that whether you're getting it done in Mexico or the United States or any other country, I mean, they do it everywhere, that there is always a potential for complications, and getting it done in one place over another doesn't necessarily increase those complications or the chance of them. So when you're choosing doctors, that's really what you need to look at. Like, how long has the doctor been performing these surgeries? How long have they had good standing in their practice? Like, what have other people said about them? What kind of referrals are you getting? The doctor that I went to, I got all the referrals. I did all the research that I need to do. And yes, he is a doctor in Mexico, but that was never the issue. The issue is he a good doctor? So, when I go now to go to a doctor's appointment and they do a history on me, they always ask what surgeries I've had, and I put down, I've had a C-section, I've had an ACL replacement, I've had vaginal mesh put in, and then now this one I will add to my list, which is gastric sleeve vertical gastric sleeve, VG or VSG, I can't remember. Vertical sleeve gastrectomy, yes. And so there's a lot of prejudice against this surgery and where people are getting it done. And the reason there's so much prejudice is because there are so many people who get it done in Mexico. And there's a lot of prejudice from doctors in the U.S. who want to, discredit that because either out of ignorance or genuine concern, that something could be wrong just because they don't know, or just because it's competition. I don't know. Who knows their motivations? Not all doctors are going to do this, but they're, typically in the past when I've listed my surgeries, nobody ever asked me where I got what done. Never. And I've not yet had to go to a doctor, so I don't know if that's going to happen. I'll definitely update if it does, but if it does, then I'm going to be very curious to see if they actually asked me if they where I got my surgery done and who did it. And there's a couple of ways to approach this. Like, I'm a very transparent person. Like, I don't care what people actually think of me. And so my choices, I know I make good choices for myself, and I know that I research my choices and I do everything I need to do. And other people don't, that may not necessarily know me, don't probably know that about me, like that I'm an overachiever when it comes to making choices and making my decisions for myself, and what the reasons why I do that. But people will make snap judgments. I've already had people make snap judgments about my choice to go to Mexico. That's just normal. But it's different coming from a doctor, especially if you have a lot of people have issues with gallbladder stones after they get this surgery done, and it's from years and years of being overweight and unhealthy, and a lot of people have their gallbladders out. So I had seen a story recently that somebody was denied care and gallbladder surgery because they had a gastric surgery done in Mexico, which is the dumbest thing I've ever heard. But it's not. There are so many people who have similar experiences. It's hard to imagine that this is all false when there's so many people talking about it, and how much prejudice they get, in the doctor's office for getting a surgery done in Mexico. So, how am I going to handle it? Well, I think it depends on the situation. So, there's a couple ways I could do it. If I go to the doctor, I could just be very vague and say I went to San Diego. I mean, I did go to San Diego. Tijuana is practically it's an extension of San Diego. So I don't see there being an issue with that. I mean, I doubt that they'll question it. And when I was younger, I actually worked a temp job at a gastric surgery center in San Diego. The other thing is just to not lie and be like, I got it done in Mexico. And if I got pushback from that, I think that would affect, if I thought it was going to affect me, and if I thought there was a good chance, or I could sense that there was some prejudice, I probably would lie and just be like, I've had sleeve gastrectomy done. I have all the paperwork if you need to see it. I got it done in San Diego. Done deal, because there's nothing wrong with my surgery. But it's all about they're going to make liability claims, and it doesn't matter where I got it done. It honestly doesn't. But the US is a funny place, right? But the other people are making kind of funny jokes, what was one person said? Oh, I got stabbed 4 times, and they removed 80% of my stomach to save my life. So, that's a cute one. And I think it's just going to come down to overall how you want to handle it in the hospital. But prejudice is there. So I had asked my friend who works for my insurance company, will my insurance cover it? And she's like, yes, absolutely. That is not the issue. The issue is if a doctor you're considering to have, perform surgery on you, has a prejudice against a surgery done in Mexico. If that is the case, you could be denied service even if your insurance would be covered. So you wouldn't, I find it hard to believe that they wouldn't give you life-saving measures, but there's a lot of things blamed on liability, insurance can't touch you, that kind of stuff. Even in the industry that I work in, that there's a lot of that. So just because they don't want to do it, and it really comes down to they can deny customers, they can deny patients. So just be aware of that. Just be aware going in that if you don't get it done in the US, you may have to dance around getting how you explain it to people, and it's going to be up to you. If you want to express that that you, or if you want to be like me and be like, I got surgery in Mexico, it's fantastic, you could do that too. You could go into the doctor's office and just be like, I had the best experience, they took awesome care of me. That's another thing. Just so you know, I have a friend who got the surgery done the day after I did, and our experiences were completely different. She got it done here, and I was shocked at how quickly they sent her home and what rough shape she was in. Whereas I was not sent home right away. I was taken care of for 2 days in Mexico, and I recovered super well and super quickly. I was walking and doing all those steps on the beach and activities, and I felt really, really good. Well, she went home. She had her surgery time at 8 a.m. and she was home by 3 p.m. and IV out and everything, and then she got dehydrated. She couldn't drink her water or take her meds. So there's multiple things happening here. She's not being hydrated, and she wasn't able to take her pain meds because the pain in her is it trachea from the tubes caused a lot of pain there that she couldn't swallow. And of course, like, you know, oral medications right after surgery, not the best idea. But she said that she was like, how do you feel so well? I don't understand. Because I was like, hey, just at the water park, you know, because we were checking in on each other, and she was like, hey, what are you doing? And I was like, oh, I'm just at the water park. She was like, how are you doing that? I feel like crap. And I felt so bad for her. And I was also shocked because in the US, the surgery is like $35,000. And in Mexico, it was $5,000. And in the US, they didn't even keep her in the hospital. And in Mexico, they kept me and they took care of me until I was ready to be released. And that I like with all my heart believe that was the huge reason why there was such a disparity in how she recovered and how I recovered. And it's just ridiculous that they charge that much here but can't keep them in the hospital for that much. So I'm just flabbergasted. I mean, it's more than just, you know, that things are cheaper in Mexico. It's the money is going somewhere. It's going, you know, into someone's pocket, and we're just not sure where. And the price is so grossly inflated. The price is definitely cheaper in Mexico because people are not being paid what they probably should be paid, you know, because I had heard that the nurses were making like $7 an hour, and that's really sad. And they're employed by the hospital, so it's not necessarily that they're employed by Mexico Bariatric. I think the staff at Mexico Bariatric were doing better than that. It was kind of obvious they were doing better than that, but the staff in the hospital were very low paid staff, and that's all rumor. I'm just repeating rumors, so don't take it at face value. But we were encouraged to tip them for that reason. But it's like it was like way too cheap there, and then way outrageously expensive here. And so, and they deny like 40%. Again, overheard. Don't know the actual. I did not look this up, but 40% of cases, I was told, are denied in the U.S. for gastric surgery. So I mean, you have to consider the experience level between these doctors as well. Like, these Mexican surgeons are doing surgery after surgery after surgery after surgery, like tons of them every day. And I mean, there was 13 people in my group, and that was just for the day for the July 4th date that we had. So you have to wonder if the surgeons here are getting the same experience level as the surgeons in Mexico. And you know, you can't put them all, like, you can't put everyone in the same box, and I'm not trying to, but these are questions that go through my mind. You know, like, are our doctors here, you know, really getting the proper experience just from like doing them day after day? And why are they denying all of these surgeries in this country? And I think that, and this is just a personal held belief, so again, this is all my opinion, but the US makes a lot of money. Well, not the US, but the medical industry in the US makes a lot of money on sick people. And overweight people are dying slowly. And they still work, they still bring in money to the system, and they have health insurance, and they pay their bills because they can, but they're in pain all day long, and they're sick, and they're dying slowly, and they spend a lot of money on our medical system. And it's really a sad thought, but I don't think that they are motivated to get people well in the US. And that's about the nicest way I can put it. And I'm not the only one who thinks this. This is an idea that was presented to me. But I think you have to do your own research. I always promote doing your own research, but there's something seriously wrong with our medical system. So, just food for thought, things to consider. Anyway, just an update from my car, and I'll do another one. I'm feeling really good, by the way. Today is actually the 7-day anniversary of my surgery date, so, and I feel fabulous. I feel I'm going on walks every day. I'm doing really well. So I cannot recommend this enough if you're thinking about doing it. And of course, I have a long way to go still. So, but this is my journey, my bariatric surgery journey. Anyway, thanks for watching. See you next time.